This is a presentation of CNN.
The procedure will be performed by world-renowned eye surgeon Dr. Brian Boxer Wachler.
Well, joining me now with some answers is ophthalmologist Brian Boxer Wachler.
So Dr. Brian Boxer Wachler suggested something new.
An experimental new procedure involving tiny plastic eye implants.
Thanks to Brian Boxer Wachler, Carolyn is about to become one of the first patients in the U.S. to get her reading vision back.
Just like almost everything else, at a certain age, our vision starts to decline. Now a breakthrough surgery is on the way. It's working wonders.
This procedure is for people who used to have very excellent vision until their late 40s, mid-40s, 50s, when suddenly their arms aren't long enough. They have to get those over-the-counter reading glasses from the drugstores.
Dr. Brian Boxer Wachler is one of only a few ophthalmologists in the country participating in the final phase of clinical trials for what's called Presview sclera implants, or PSI.
It's the only procedure that directly reverses the effects of aging. We open the white part of the eye, and we use a machine that creates the little belt loop between the two marks. And then I place the insert underneath that belt loop there. And that actually pulls up on the area where the muscle is. So it allows the muscle to be able to pull on the lens and people can focus and read again.
But there are some risks to having this type of surgery, and our own Dr. Bruce Hensel is here with us now to tell us about some of those.
We're going to show you how they happen, how to prevent them, and the doctor who corrects LASIK mistakes.
Her problem was the laser didn't remove her tissue in the same area all the way around, so it caused irregular amounts of astigmatism.
Dr. Boxer Wachler can do the correction in less than 2 minutes.
I use the laser to smooth out the irregularities in the surface underneath the flap.
Just a few days after the surgery, Jackie could see the results she always hoped for.
For your health, I'm Kat Carney. There's a new procedure called orthokeratology, or Ortho-K, which promises to have you waking up every morning with close to 20/20 vision through the use of special contact lenses and no surgery. Well, joining me now with some answers is ophthalmologist Brian Boxer Wachler. Dr. Boxer Wachler, thanks so much for being here today.
Good morning. Well, the way this contact lens program works is by using hard contact lenses, and I'll show you an example here. They are applied on the surface of the eye so that during nighttime wear, they are actually doing reshaping of the front part of the eye. This is called the cornea. And when they wake up at the morning time, they take the lens off and the cornea has been reshaped, and that allows them during the day to have improved vision.
Implantable contacts are offering nearsighted folks an attractive option.
People are really excited about it because they know it's like a contact lens, which they're very familiar with, and could be adjusted if it ever would need to be in the future.
The procedure takes 22 minutes.
We use numbing drops, so there's no pain at all. And what we do is make a tiny little opening at the very edge of the eye, and we slide in a little lens, and then we just use an adjustable technique to close a little opening, and that's pretty much it.
Dr. Boxer Wachler is testing a new type of implantable lens, one with a special antibacterial coating.
An infection is probably the greatest concern with any procedure, but we haven't had any of those issues with this lens because of the special coating on it. My environment as an eye surgeon is very delicate. And in our surgery room, we need to create a very sterile environment for patient safety. Part of our sterility protocol is now to have a unit, because not only does that filter all of the particles, even down to submicron level, but it also filters the gases, because the laser that we use does emit some laser vapors. As a medical doctor, it's the most effective way to clean your air.